to be here, and it's always great to share knowledge and learn from each other. So I think that's the invitation, and every time that I have the opportunity for me sharing whatever I have to share and learning from all of you, it's really, really a pleasure. So the invitation for this presentation the title is Functional Approach to Childhood Disability Beyond Diagnosis. So thank you for the introduction and the invitation. You are seeing a picture of the campus of the University of Victoria in the province of British Columbia, the west coast of Canada. Beautiful place. Sometimes we have warning that it's going to be very hot, and it's going to be 27 degrees Celsius. So if they come here, we'll have a warning like the entire day. But so for us, it's like kind of really hot. A disclosure, I have no financial interest. I'm really motivated and driven about what I do, and everything that I'm going to share is open access, every paper, every project, so you're welcome to check that. As our friend described, I'm part of the board of directors of the American Academy of Cerebral Palsy and Developmental Medicine. I am a founding member of the Latin America Academy of Child Development and Disability. I have like a strong connection with my country, like my original country, Argentina, and I think it's really important to give back. I train in a public system over there, and I work now in Canada, but I always help. And doing like this, every time that I go home, I share whatever I can. And I'm a consultant for UNICEF in Latin America. And I led one of the tools that I want to share with you based on the ICF, and it's dedicated to children and youth with cerebral palsy. And of course, I'm sharing my ideas and opinions. So the invitation is to take a look and have this presentation with this perspective, a lifespan perspective. And I'm trying to make that a strongly message about, like whatever we do, it has an impact not only in the kids right now, but across the lifespan. The invitation is to review briefly these objectives. So introduce a functional approach, and I know that in previous presentations you were mentioning the ICF, and it was really nice to see the Greek words for each one of the concepts. Review some applications and share some initiatives, and hopefully it will inspire you to join some efforts or start your own projects. So the developmental trajectory, you're going to see like a short animation, and it's like really, all of us that work in pediatrics, we're working with a moving target, that is really fascinating to see how they develop, and they are, the future's adults, and we are contributing to this society and the whole cycle of life. So for me, it's really inspiring to really focus on early intervention or child development, because, like we are like making an impact in the future. So I'm sure you're well aware of the evidence, like global evidence about why it's so important to invest in child development. And there are a lot of research and evidence showing that is a critical stage. The early child years is a critical stage of human development. And it's not only like the environment, like stimulating like migrations and synapses and connections, but it's like the neuroplasticity, and it's how fascinating it is to see, how we can impact a developing brain. So the environment is crucial, and you were showing, like, you know, in your presentations, like interactions and making a case that, you know, the home, the community, it's all the experiences in early childhood are crucial for neuroplasticity. And I'm just showing this was part, and the figure that you are seeing is like on the top row, kids that didn't have like a nurturing environment and stimulation compared to the brain functioning of kids that had a really nurturing environment. And you are seeing the colors like, you know, more functional brain activity and stimuli in all different parts of the brain with darker colors that is more functioning and more activity compared to the ones that were not really having a really good stimuli from the environment. So these are information that are well described in different series of the Lancet that have dedicated to child development, and I invite you to have a look. The last series was published in 2016. There are many risk factors, and we know, like, from every day, you know, when you work in clinic, you know that the social determinant of life impact child development, and there are many risk factors that we know that affect kids around the world. Poverty, abuse or neglect, parental substance abuse, poor maternal health, infections, and exposure to violence, just to mention some of them. Why is it important to identify risk factors? Because we know that the more risk factors that the kids are exposed, the more risk of presenting a developmental disability. And it's important because we can change the environment. We cannot change the brain now, like, you know, there are many projects and many research studies trying to impact the structure of the brain, but I think it's easier to prevent and impact the environment that the kids live in. Again, in the first years of life, the interaction of children with the physical and social environment, that is all of us, families, schools, community, the healthcare team, play a determinant role in their developmental trajectories. And again, with long-term implications for their health, well-being, and earning potential as they become adults. So it's important that we think about, you know, the impact, again, looking ahead, looking at the cycle of life. Again, just to stress, you know, why is important what we do. Failing to reach their developmental potential contributes to global cycles of poverty, inequality, and social exclusion. I'm a developmental pediatrician, and I love and I think it's fascinating to see how kids grow. And we need to think that every child follows a developmental trajectory, and kids with disability follow these developmental trajectories as well. And it's a continuous. They keep learning on their own way and in different areas and domains of development. And it's continuous. That's, you know, like how we observe and how they grow. But then when we plan services or we plan research projects, we start separating or fragmenting the information, and even that reflects in data collection. I do a lot of research and we publish, and it's like very compartmentalized. So you just focus on one group, younger than 3, 3 to 6, older than 6, and sometimes the services are planned in that way or the programs are planned in that way, but that's not the reality. And the kids don't stop, you know, at 3 and then, you know, switch to a different kid at 4. So, like, I think the challenge for all of us is to trying to mimic the developmental trajectory with the services and programs and research information that we collect and how we reflect that information. So that's a challenge everywhere, even in Canada. So we need to be aware of that, and that means that the services and the professionals need to talk to each other. The continuum will be that, you know, like that we follow their trajectory, not that they need to follow us. Another key message that I always try to, when we have this invitation of reflect about a functional profile or a functional approach, is to try to think on natural context. We work or we spend a lot of time in hospital settings or in clinical settings or in research settings, but that's not really the reality of the child, and they grow and play and live outside the hospitals, outside the research centers. So that's why it's important to really think about that, how it's important and what really reflects the information that we have or the assessment that we do, or like you were showing, like feeding assessment, eating assessment, how does that look at home or at school? So that's important to really think about, how everything that we do, assessment, evaluations, interventions, how that impact the everyday and how they look like in a real environment. Again, how to really think about a functional profile approach to childhood disability. What is important to families and kids, and I think that many times we need to stop, reflect, and say, is this meaningful, what we do, the project that we do? Is it going to make really a change? Are we going to really help families and kids around the world with all the time and effort that we spend on everything that we do? And so it's important to know what is important to them, like exactly. And it was, we did a really nice study like 10 years ago, asking children and families about what really functioning means to them. And everybody really focused on functional abilities, what they can do every day. That's what they care about. It's important to have a diagnosis, but it's important to know what's really relevant to the families. Back in 2007, I was doing the fellowship in developmental pediatric, and the pediatric version of the ICF was published. So there was a lot of noise and excitement about the ICF. And so I was lucky enough to be surrounded by people that were really excited about the classification, and I was able to work on a specific international tool. So you know that there are many WHO classifications, but the classification, the main thing that got me was that working with kids with chronic conditions, it was really hard to have like a different approach, as I was trained in acute care, not a lot on chronic conditions. And so I think the ICF, like, it was great to have this knowledge of functioning, that is what a child or adult is able to do every day. No, it's like a more concrete notion of health. Measuring health, quality of life, well-being, health status is really abstract, but functioning is something very concrete. So something that we can really describe using the ICF language. And as you might know, the invitation from the ICF is that we describe functioning following these areas. And you mentioned those in some of the presentations: body structures and body functions, and the dynamic interactions with activities, so a task that the kid can do every day, and the knowledge of participation, so a social interaction in everyday activities. And I'm using color coding, and you'll see that along the presentation. So the invitation is that we have these red areas, activity and participation, as part of us in everything that we do. That's the functional part that we are including in the everyday assessment, evaluations, or research projects. And the interaction of all these parts, that means functioning, everyday functioning. And the ICF adds, the concept of the dynamic interaction with the environment that we mentioned, that is so important, the contextual factors, including environmental factors and personal factors. What is functioning? Again, like us healthcare professionals, we have like an own perspective about what is functioning or what should be functioning in everyday life. But another really big message is to ask the child directly what functioning means to them. Sometimes, you'll be surprised that they have a different interest or perspectives. So some of my projects are dedicated to talking to kids or creating tools to capture that information directly from the kids, those who can effectively communicate or create ways that we can capture that. So that's another big message, that really try to bring that information to your everyday activities. The functional approach from children's perspective that I was mentioning, we did this qualitative study asking kids with cerebral palsy aged 8 to 18 years old. And it was really, really surprising that, even if the kids have a severe impact on a physical or motor ability like GMFCS 4 or 5, the children were describing their everyday or their interest as any, if you read the scripts of these interviews, you cannot tell what kind of impact they have on motor functioning. So that was really eye-opening for me, and say why I was expecting that they would mention things in a different way, why I was having a different assumption. So I was committed to change this and do research with children, so capturing their perspective in a very respectful way, and not doing research on children. Another thing is the environment, and I say we are part of the environment, and you mentioned some of the factors that there are facilitators and barriers, and of course the family and having healthy parents and looking after them, because they need to look after the child and feed the child and spend so much time looking after the children. So there are many environmental factors, and I'm showing some, like friends and adapting the environment, the physical environment, and adapted technology that should be really something that we need to consider, because that can help the kid functioning every day. And there are many physical barriers, like steps or attitudes towards disability. And I'm on purpose putting the healthcare team in the middle, because sometimes, even though we have the best intention and we work nonstop, and you are here on a Saturday learning and spending more time, sometimes our perspective and even the language that we use when we communicate things with family, or we gather information and write reports or write in the healthcare records, are not really facilitators. So sometimes we need to educate ourselves to change the attitudes and respect the independence or the autonomy of the child. That means listen and make a big effort to collect information from them and changing the language. And I'm going to show you some of the projects related to that. Another big thing of the ICF is that incorporate the Convention of the Right on the Child and People with Disabilities. Most of the categories included in the activity and participation domains of the ICF reflects the articles of the Convention of the Child, of the Right of the Child. So it's really important when we are using one of these tools, we are really advocating for children's rights. So, and sometimes it's important to review as an educational session, review the Convention on the Child, on the Rights of the Child. And they say children have the right to information, so we need to create accessible information, child-friendly information when we are sharing information, even with the entire family. You have to have information at the level of the child. The children have the right to express their opinion, so I'm on a mission about that, to health, to education, that's health quality, access to quality education for all, to recreation, that means playing, and to social inclusion. So it's really nice to review, why it's important. And I know that we are in a clinical setting, and most of you, on a daily basis, you see families and you see kids. And so it's important to show in a practical way how the ICF will work. So I always show Lucas that he's 6 years old, and he travels with me, and he has cerebral palsy. And so if we try to, apply the ICF as a framework, if you want, in this scenario, what are you seeing? What's going on here in the picture? So is anything wrong about this picture? He's not playing, no? He's not part of this. So if you put 4 kids in a room with a train, all of the kids will be around the train, no? That's the expectation, that we know that, like they'll figure it out. They will be fighting about the train. So we can see that this is not, expected, or the scenario that we want. And so we can apply the ICF, and we're identifying already that there's like a participation restriction. And if we apply in the other domains of the ICF, we can assume, knowing that he has cerebral palsy, that there are impacts on body structures. So there's an injury in the early development of the brain that is affecting body movement, so he's not walking. And so body functions, control of movement is a body function. Walking is an activity. Participation, like playing. So we're identifying some of the components of the ICF. If we identify the environment, so there are no barriers, physical barriers, like we can assume that he can move, like the wheelchair. There are facilitators. He's like wearing, like he can access a wheelchair, so that's a facilitator. But there's, something else about the environment that is not working very well. So you might identify that the kids are not paying attention to Lucas, and the toy might not be accessible to Lucas. So in terms of personal factors, like we can work with him to try to show motivation and show interest in the train. Another part of the ICF that we can identify that is maybe communication issues. And, communication, it could be like an activity, and it be part also, if it's part of a conversation, it can be part of participation. So the invitation is that we already can apply the ICF in a practical way when we see these kind of scenarios. What is really interesting is to try to plan interventions using the ICF. So what can we do? We can try to facilitate communication with technology, and that might be a big facilitator, so we can work on that. We can educate the peers, and it's really important that the other kids know that anyone, even if they have cerebral palsy or if they are using a wheelchair, they are interested in a toy like them. And so we can change attitudes and teach the peers. The last part that is really interesting is that if you work with technology, a technology team, we can work with the toy and adapt the toy and get optimal functioning. So in this brief scenario, you'll see, how we can apply the ICF in a practical way. How you should think about is beyond a classification that have codes and describe kids by codes. It's like just a way of thinking about situations. Evaluate the situation and plan interventions using the ICF. The nice thing about these kind of scenarios is that I try to show this to academic groups, clinicians and trainees, but I also go to schools and show this scenario to kids in different classrooms. So I ask the kids, what was the problem? And most of them will say right away, kids from 5 years old to older, they'll say, well, like Lucas is not playing. But when I ask them, okay, how can we fix this? What are the solutions? So some of the kids, say like, oh, we can have more trains. So if there are more trains, like there are no problems. So the kids will already start, you know, like providing some information. And it's really nice game to think. One of the child, like he was like 5, he said like we can make the wheels of the wheelchair like smaller so he can just go and be at the level. Another child said like we can put a train on top of a table. So there are different options, and it's really nice to work with them so they can realize that, you know, first that there's an issue when a child is not playing, and then there are solutions that we can be part of. So that's briefly how to really, you know, like you can apply the ICF already without knowing like the technicalities of the classification. And how you can adopt the ICF, and there are many ways. And this, like the exercise is like talking about only as a conceptual framework, just to see a situation and plan interventions. You can use it as a universal language, and I know that there are people from different backgrounds, and sometimes it's really hard to communicate when you present, you know, your technical jargon. And when we try to use the ICF across the team, it's really easier when we say, oh, we are like focusing on activities, or we're focusing on participation or specific areas. So that's another invitation to use it as a universal language. You can use it as a classification tool, and I'll show you an example. And the other thing is to compare functional information. Usually, as a country or as a region, you have a lot of information. You collect information, you report to the national system some information, and mostly are used on diagnostic coding, but not on functional information. So we're trying to change that and create an easy way to create indicators about functioning. I did many studies that we describe in Canada, how people access, how kids with epilepsy access services across the province. But we could not answer the question if they were needed, the services were needed based on the functional abilities or functional needs of the kids, because we didn't have any information about functional needs. So we need to change that. Diagnostic, just having a diagnosis won't really tell you, because, you know, like if we can have one code for cerebral palsy, like you know that there's a whole spectrum of functional abilities associated with the diagnosis. So it's important to make decisions and allocate resources. So this is a project that I led. I created the ICF, like I led the whole project, the ICF courses for children and youth with cerebral palsy. And the idea was to select the main categories representing all the components of the ICF that are relevant for children and youth with cerebral palsy. And this was an international project, and we have people from around the world. And I think we identified that there are so many classifications about cerebral palsy. So you can classify gross motor abilities or fine motor abilities, feeding, communication ability. But, you know, and there are many measures that you can use, but there was no one universal measure describing functioning as I am trying to describe how to use the term functioning. So this was published in 2014, and it's an open access paper. And the invitation was to have really a tool that described the developmental trajectory. So it's not one tool for a specific age. So you have an option. There are 5 different versions of the corsets, and the brief one has 25 categories describing all the components of the ICF, and you can follow the developmental trajectory of functioning of kids with cerebral palsy using these 25 categories. Then there are age-specific, but the idea is that you really can track the kids' abilities as they grow. You can create many things like templates and your own forms that people, like you have the ability to be creative about this. And this is one example of an intake form in an electronic form that you have a designated area for the perspective of the child. And then you have the categories and a specific vocabulary using the ICF. This is another tool that you can use. You can create a profile of functioning, and you are seeing the qualifiers 0 to 4. And this is in one page. You have the description of functioning of this child and the environmental factors that you can modify or you can plan to modify in your rehab cycles or your interventions. So it's like having this and try to compare time 1 with time 2. So the assessment and evaluation is having concrete information about functional data. This is an example of how, we use this color coding, and if you remember, the red is activity and participation. And this is another paper that we published comparing the perspective of different groups. Like, you can compare the researcher perspective in the literature review to the expert survey. These were experts from around the world. And you can see the different representation of the red, if you want, the activity and participation. Then you will ask the children and family, and they have more representation of red, activity and participation, and environmental factors, that those are the things that they care the most. And then in clinical studies showing the health records, that they have representation of activity and participation, but they were very restricted in some areas. It was not really describing the entire content of the ICF. So you can use it in many ways. You can do these exercises. In every day, you use these terms. You were showing in some of the presentations, motor abilities or feeding abilities. And the idea is that you stop and reflect and say, every day, what areas of the ICF I'm covering. Usually, as we are trained in body structures and body functions, we are really in that area of the ICF. And the invitation is to stop and include systematically other areas of the ICF. You can also check, most of us use different set of tools, measures for different things. And this is an example of tools related to pain, how to assess chronic pain. And we have done different exercises to try to describe every one of the tools using the ICF. So sometimes, it's quite surprising when you say, when I use this tool, I'm only covering areas of body functions or body structures, like asking the child, where do you feel pain, or the intensity of pain, that is body function, but not really the impact on everyday activities. Like, you need, a combination of tools that will capture information about the activity and participation here in red, and some environmental factors, how pain impact on family or activities of daily living. There are many tools and how we are using these tools around the world, and this is another publication that you can access. And it summarizes different approaches in using the ICF courses for cerebral palsy in different countries at different levels. Not everyone has the system or the capacity or the training to use the ICF at a more detailed level, but you can use it, like in Brazil, they use it to describe the profile of functioning of kids with Zika virus. In Russia, at a system level, they changed the approach to evaluations of kids across the country. We lost contact with the group after the war, but they've been doing really nice work in trying to get, like a universal language about functioning in the whole country. In Malawi, it was at a community level, and in Poland, it's a rehab center describing how their services align with the ICF. So there are different examples that you can, if you're curious to see how to use it. There are positive messages, and the main thing is that when you start about learning and teaching and trying to apply the ICF, there's a really positive change about perspectives towards disability, and that's really, really nice to see. From impairment-based to functional base and why it's important. There's a big change in incorporating participation as an outcome. It's really important. It's not just about walking 2 meters or it's about participation as a real good outcome. And it's really nice to change environment and use it as a systematic way. And for me, it's important to inform policies and promote health equality. So the minute you have information about functioning and about barriers and how to change it, we can shape policies and programs. It's not only about cerebral palsy. You can use it, and there are many tools and different tools for other pediatric conditions, and this is an example published in the MCN comparing ICF tools for ADHD and autism and cerebral palsy. And I want to show you some ongoing initiatives promoting optimal functioning. And we created this educational e-tool that you can access. It's a website that has 5 cases, because there are 5 versions of the corsets for CP. And you can go step by step, and it will help you to see in a practical way how to see this. And it has the color coding along the way. So right away you identify the different components of the ICF, and it's really nice. And it has the whole range of GMFCS levels. And the other nice thing is that we learned from children, like from that qualitative study, that they really use positive language when they describe themselves. And so that's the other big project that I'm trying to disseminate around the world. It's called My Abilities First. And it's a really invitation to systematically capture the voices of the children in healthcare. And so there are short animations that I can share with you later. There are links to YouTube videos. And the invitation is to create My Abilities identification cards, that you include that in health records. So the kids are quite creative, and they are recording short videos that ask the team to see before reading their health record or before seeing them. And it's really nice to see that, if we read a health record, it will say CP and GMFCF, or the severe or moderate impact of CP in motor functioning, but usually it won't describe really the child and how, they come across. So it's really nice to see a short video of them. I have an example. Let's see if there are different countries using this. I think later on I have one. And this is an example in Canada using an abilities-oriented approach across the lifespan. And this is a unique clinic. It's an accessible care pregnancy clinic in Ontario, Canada. And it was designed with people with disabilities, with women with disabilities, and the whole team, maternity team, and they provide accessible service across the pregnancy, and it's a really great example. My Abilities First have been used in different countries and be part of different campaigns. You might have seen this in Europe. It was part of a campaign 2 years ago by the European Academy of Childhood Disability. And it's really nice to see, how involving kids will change, how we even organize academic meetings. We'll start the meeting seeing some of the videos and some of the kids describing themselves. Another tool that is another thing that we can share is this book that was published 2 years ago, and again is open access, and is dedicated to early child development. And it has 16 chapters, and some of the chapters were written by people from the World Bank, people from WHO, different groups, and different groups around the world. So it's really nice to see how the world is paying attention to early child development, and again, thinking about how to gather evidence, how to report that, and how to shape evidence-based policies. This is one example, and the co-author of this is Rune Simonsen, and he was the one leading the child version of the ICF. He led the working group at the WHO, and so it's a pleasure to work with people with different backgrounds. So he's coming from the special education background, and we are trying to invite people to think that we need to work across sectors and across the lifespan. So this is an example. Another example dedicated, included in the book, is trying to be innovative, and I think COVID helped us to think about, how to use information, tele-intervention, and this is not new. Like in US, this model of routine-based model that you might have heard has been around for 30 years and it's been used in 10 countries. And it was great to see that when COVID hit and people couldn't access service physically, the program kept running because they had this all set up as a virtual interactions, and it was really great to see. So there are already good ideas out there, and we were including in this paper that you can use that model and include positive language at the same time. One more paper to share. This was published in the Lancet last year, and is called Every Child Matters, and it's again an invitation to think about inclusive ways to not only include people with disabilities or kids with disabilities in the discussion about things that affect them, but it's about people with different backgrounds and cultural background, and this was dedicated to indigenous children. So how can you adopt the ICF? And I know that you're already having the concepts and know some of the ways to use it, but try to expand, the way that you're using. The big invitation is focus on functioning across the lifespan. Try to use positive language and check, like if you are using that already. Sometimes when you interact with the family or the child, you use positive language, but that doesn't reflect on your reports or on your final conclusions or information that you share with the community. So try to change that. Incorporate the voices, and you can use many ways. Like you can, some ways is taking pictures and describing a picture that will really describe the child. Having a video, that will be great. I can share some of the examples then, by email, but it's really make a big difference, and disseminate evidence on importance of child development, and I think you know about that. I'm very positive that there's a really great change ahead of us, and child development and early intervention is key and very important right now, so we need to keep advocating for this, education, collaboration beyond health. We need to take a lead on this, and so it's sometimes like we are busy, you're doing too many things, but it's important that you take a lead on this and promote autonomy and respect. So we are finishing, and in summary, there are so many things that we can do, but again, it's like the implications for your everyday practice. It is important to make early diagnosis, and this is really, this is not one way or the other. It's not diagnosis versus functioning. It's complementing both. So we need early diagnosis, but we need to really capture information about functioning because, we are trying to make a case that we need to align with the needs and the relevance of what we do, and it's like aligning this with expected from the child and the family. Try to use some of the ICF tools that are available to you. They are all of them open access. And after all, is what we try to show, that daily functioning is what families and children value the most. I think this is the end, and I'm sure you'll have some questions. Thank you very much for your attention.